Hello, good morning. Today I would like to speak on vitamin B12 deficiency. There are multiple vitamins like vitamin A, B, C, D, E, and K. So, some vitamin deficiencies are quite common in the population, like vitamin D deficiency, vitamin B12 deficiency, other vitamin deficiency, in some areas vitamin A deficiency. So the symptoms and signs of the deficiency are different for different vitamins. For example, for vitamin A, it will the problem may be in the skin as well as in the eyes, like loss of vision or night vision. And vitamin E may be manifested as unsteadiness. Vitamin B complex has a different manifestation like anemia, glossitis, numbness, paresthesia, and some behavioral abnormality. Vitamin C will manifest as bleeding manifestation. D will manifest as fractures and bone pains and muscle weakness. So today my focus of interest is only vitamin B12. So the vitamin B12 is supposed to affect around 15% of the population throughout the world, especially in the elderly. And the vitamin is quite common in all non-vegetarian diets, like whether it's milk products, meat, and other all poultry and other all sort of non-vegetarian food. And this is practically not present in vegetarian diet. But maybe there are few slight quantities of vitamin B12 present in some legumes like some beans and peas. So practically it's present only in from non-vegetarian sources, either from milk or from milk products or from meat and other meat products. Okay, so what are the symptoms of deficiency of vitamin B12? So basically this can affect any part of your body. It can present with anemia, cell abnormalities, or maybe some premature gray hair, early gray hair. Somebody getting gray by the age of 25 or 30, you should think that this may be related to the vitamin B12 deficiency. They can present with the dementia, memory impairment, unsteadiness, dizziness, visual impairment, spinal cord problem like unsteady or weakness or dragging of limbs. They can present the numbness, tingling, and paresthesia due to peripheral neuropathy. There is one condition called subacute combined degeneration, where there is involvement of the spinal cord, which would manifest as unsteadiness, tingling, paresthesia, and weakness. Sometimes they can be additional neuropathy, peripheral neuropathy, nerves getting affected. So they can have peripheral neuropathy, spinal cord involvement, multiple nerves in involvement, and they can present the numbness, tingling, paresthesia, weakness, and any sort of, starting from the skin to any part of the body. Alright, so it's quite common. It's as I told you earlier, around 15% of the population, especially in elderly. There are various conditions which should cause vitamin B12, like low gastric acid level, chlorhydria, various cancers, and people who are abusing drugs like for gas or acid peptic disease like omeprazole, pantoprazole, ranitidine, famotidine. Many drugs are supposed to cause B12 deficiency. So never abuse unnecessary drugs. Okay, only if required for that particular time, as per the advice of the consultant or the doctor, you should take. Never ever consume long term this gas drugs. In the same way, there are certain drugs called biguanides or metformin. That's used for diabetes. So that will the prolonged intake can also give rise to vitamin B12 deficiency, and they can manifest in any of the various methods, starting from the skin to the brain to the bone to the muscle. So any parts can get affected. And there are various other conditions like problem in the pancreas, problem in the terminal intestine called the ileal disease, and some other chronic conditions, some of which are common in our country, some of which are not common in our country. So the main source of vitamin B12 is non-vegetarian food, as I told you earlier. So if you don't take non-vegetarian, then you have to take additional supplements of vitamin B12, either fortified with food or you can take extra. Ideally, if someone is having low vitamin B12, they should take parenteral injection or ingestion of the vitamin B12, maybe for daily for a week, then once weekly for a month, and monthly to continue. then of course there are, you can take a high dose of oral vitamin B12 also. This is also possible, but the absorption is quite erratic. And there are gels available that can be applied in the nose. That's also possible, but I don't think it's available in our place. But we can try that local application as well. So you should understand that the symptoms are quite common. So since there is a store of vitamin B12 for around 2 years, somebody who stopped eating meat or fish or whatever non-vegetarian diet, they wouldn't manifest the B12 deficiency at an earlier date. It would take at least 2 years. And by the time they wouldn't manifest the full-blown disease like memory impairment, unsteadiness, numbness, but it can come just like a diabetes, because the diabetes starts as initially as fasting, glucose is going up. Later, after food, the blood glucose goes up. In the same way, the serum B12 will be low, and they can slowly manifest as tingling, numbness, later on mild graying, some fatigue, memory impairment, unsteadiness. So it gradually comes over the period of years, not over days or months. But there are certain drugs like somebody who abuses some nitrous oxide, like as a recreational use, they can manifest a high dose of they can manifest quite fast, like weakness or unsteadiness, like nitrous oxide abuse. All right, and any condition like ileal disease, pancreatic disease, gastric disease, or any mutation of the various AMN mutations, there are tubulin mutations, there are various factors, R factor, then you have haptocorin mutation, then you have the transcobalamin 1 and 2, but there are many such carrier proteins and binding proteins available. So if any abnormality of any of these factors can also give rise to vitamin B12. So this need not be because there are people who who will come and tell you that they have been taking non-vegetarian diet every day. Still, why this is possible? Because this may be because there may be some problem in the absorption, either at the stomach level, or in the pancreatic level, or in the small intestine level, or there may be problem in the absorption at the brush border of the intestine. So we have to evaluate why he is developing vitamin B12. In those cases where patient wouldn't improve, or they have got certain other features like a problem with the stomach, like gastritis or pernicious anemia, or cancers, or other tuberculosis, or other rare inflammatory disease of the intestine. Okay, so today I'd like to stop here by telling you that vitamin B12 is quite common in the poor population. You can prevent it, and if you feel like this sort of thing, maybe you can consult a doctor, and maybe once in a year you can check the vitamin B12 level, especially if you are a vegetarian, or if somebody or some Ayurvedic physician, or it is common in them to certain rigid food control, like don't take this, don't take that, don't take non-veg, like that. In those cases, if the person is developing any numbness, paresthesia, forgetfulness, it's always better to think of a condition called a vitamin B12 deficiency that would come in a gradual fashion, and it would take it comes with various manifestation. In those cases, we have to replenish the diet, like the vitamin B12 containing diet, that may be milk product, or fish or meat product, or even fortified vitamin in the diet. Okay, with a few words, let me conclude here. Thank you very much.